Good afternoon. Aventyn is a company that's been working very closely with providers, payers, and pharma companies to deliver what we call a connected clinical information platform. About 3 years ago, we started off looking at heart failure as being one of the very complex problems in trying to manage patients that ended up going to the emergency room or getting re-hospitalized after any type of procedure that required them to follow a certain kind of guidelines. Since then, as I speak today, there are patients waking up in the U.S. right now that are on our system that are using a variety of vitals monitoring devices to capture the vitals information, interact with a mobile device to describe the kind of activities that they have been experiencing, as well as symptoms that they respond in the form of a questionnaire on a daily basis that they send to a clinician that's monitoring their activities and trending a lot of their clinical conditions so that they can be better managed remotely and from the home. One of the things that we learned over the past 3 years is that this is a global problem, not just a U.S. problem. So we ran an international multi-center clinical trial just very specifically trying to address the congestive heart failure patient population problem. That trial was very successful to the extent that the American Heart Association last year validated and published the data at the annual Congress in Chicago. The aspects of CHF, especially the comorbidities associated with CHF, is not just related to heart failure problems alone. So today our platform is addressing the several more comorbidities related to CHF, such as sleep, COPD, asthma, chronic pain, for example, hypertension, and then moving on to a more complex problem, which is chronic kidney disease. So in the context of what we're doing, we have partnered with a variety of hospital systems that we are today working with that have over 1 million patients in their population base, but at the same time, today we are touching tens of thousands of patients when we hope as we move forward in time that we can very successfully address some of these chronic problems, very much focusing on what we believe is the right approach, using clinical evidence-based practices to deliver services that are looking at some very measurable type of metrics, such as patient outcomes, improving patients' quality of life, and not least trying to understand how we can drive a lot of these cost factors down. So as you can see today, we have been quite successful not only on the U.S. side, but working with our hospital partners in Sweden, in UK. Very recently, we've been also doing some project work related to chronic disease management in the Emirates, as well as, of course, in India. These are standard off-the-shelf type of solutions which can work pretty much on any type of global wired or wireless type of an infrastructure. So as we move forward in time, how do we connect patients and clinicians? Last year at the annual HIMSS show, we did a very interesting demo of a Care Anywhere type of a platform. What this entailed was Intermountain Healthcare, which is a very big hospital system in the United States, along with a variety of their partners, were looking to figure out how do you move a patient from the bedside to the home and not lose that quality of care. So we did a demo that basically took a wearable sensor that the paramedics would use in the ambulance as they were moving the patient from the bedside to the home and not lose any of the vital sign monitoring components that made up part of that system. So a clinician remotely was able to observe a lot of the vital signs as the patient was being moved. So that was one of the key components of it. Today our platform, which is what we call a clinical information platform, not only has our very own electronic health record or journal system. We bring data in from different types of wearable devices that are used at the bedside, at home, or for wellness or preventive type of approaches. But at the same time, we also bring in DICOM data from different imaging modalities. And as we are moving forward in time, we are now able to not only add components such as a very simple form of a genome report, lab reporting, et cetera, to our platform to enable wellness and preventive type of services. Last but not least, on the clinical trial side, we are very much focused on trying to obviously look at how we can improve not just the quality of life metrics, but driving a lot of this cost down, but also bringing a very diverse set of data points into the longitudinal patient data model so that we can deliver a lot of the integrated chronic disease management services through our provider partners, our pharma partners, as well as our service providers that are helping roll out these models on a fairly large global platform. So with that, I will stop. You have my contact information. Please feel free to contact me if you have any questions or if you find any collaborative opportunities.
Thank you very much.